Hello, I'm Bonnie Kyle. I'm one of the consultant anaesthetists here at Barts Heart Centre. I'm also one of the medical leads for NatSSIPs at the Barts sites. So I'm going to talk to you briefly about how we do NatSSIPs here at Barts. NatSSIPs really encompass the way that we approach safety. So NatSSIPs stand for National Safety Standards for Invasive Procedures. Really, it's something that should be used whenever an invasive procedure is used in this hospital, and they have been developed and extensively modified as a result of the WHO checklist. When we do major invasive procedures, so those procedures that are done in the operating theatre and in cath labs, there are 8 sequential steps that we need to verify. We need to verify the procedure and the site marking, so that's the consent form with the patient. We need to have a team brief, and then we need to sign in, time out. If there's a prosthesis, we need to verify it. We make significant efforts to prevent retained objects, and then finally we sign out and we debrief at the end of the procedure. So as I said, the major procedure areas are the operating theatres and the cardiac cath labs. It's important to remember that on the consent forms, no abbreviations should be used, and that if there is laterality in the procedure, site marking must always be present. The team brief itself should always be done in theatre by the whiteboard, and ideally all 3 of the lead operator, the anaesthetist and the senior nurse should all be present in the room at the time, as well as anybody else involved in that procedure. All team members introduce themselves, and then their names are placed on a whiteboard for ease of reference later on in the case. And also a template is available for any of these briefs if not everybody can remember exactly what needs to be discussed. There are 8 sequential steps in major invasive procedures. It's very important that the person initiating these steps ensures that the whole team are ready to do it and engage properly. And as mentioned, all prostheses need a 2-person verification process. And at Barts, any patient who has retained packs, who may go back to ITU with an open chest, they will need to have a pink wristband on. Minor procedure areas are critical care unit areas, wards and clinics. These can include procedures such as TOE, percutaneous tracheostomy, central lines, chest drains. They're basically all invasive procedures that take place outside of the operating theatre. There are 2 types of checklists for this. There's a generic one for which the procedure that you're doing perhaps doesn't fall into any specific one, and there's also very specific ones, for example for tracheostomy. These are shorter lists, but they do still require 2 people to check them, and you must record the use of this checklist when you record your procedure. We are audited regularly at Barts. We do a qualitative audit on a quarterly basis to look and see how we're doing compared with the rest of this trust, and we discuss the results of this and see how we can improve. And this is an example of some of our data from last year, which audited the quality of our team briefs. When we've talked about this audit, we've been able to establish what good looks like. And essentially good is when all team members are ready, when all team members are introduced, when we all engage with one another and we use silence effectively so we can listen and hear one another, we share clinical concerns, but most importantly, that the team feel confident to speak up where there are concerns. So at Barts, we take safety incredibly seriously. We would like you to use these NatSSIPs whenever you're involved in an invasive procedure. And if you have any further questions, you're very welcome to contact me.